Hi everyone, my name is Ivana and my disease presentation is on cryptosporidiosis. The formal name to this disease is known as cryptosporidiosis, and the parasite that causes this infection is known as Cryptosporidium parvum. The main causative agent of the infection known as cryptosporidiosis is due to the microscopic intracellular parasite known as Cryptosporidium parvum. This parasite will cause severe diarrhea. It is one of the most common symptoms of this disease. And these parasites also live in the intestines of infected peoples and animals where they will multiply eventually. So the organ system that is tremendously affected in this infection is the intestines. Cryptosporidium lives in the intestines of humans, and they are passed or multiply onto others through the stools of the infected. In one bowel movement, thousands and even millions of Cryptosporidium parasites can be released, therefore infecting other individuals or animals. Populations at risk are those individuals who work in large group settings, for example, young children who attend daycare, even the daycare staff workers. Also, individuals who have weakened immune systems are at very high risk to contracting this disease. And also international travelers, hikers, and campers, because since they are surrounded by lakes, oceans, bays, streams, they have an easier chance of touching contaminated water or even drinking it. So therefore, they're at high risk. And also, this infection, there's no specific ethnicity or age group at risk. It's just anyone can get this disease. Portals of entry to this disease is that it enters through the mouth through ingestion of water, and it exits through the feces. In one bowel movement, millions of Cryptosporidium parasites can be released, therefore infecting other individuals. Symptoms of this disease can usually begin from 2 to 10 days after the infection, after exposure to the infection. The most common symptom of this infection is severe diarrhea. Other known symptoms are dehydration, fever, nausea, stomach cramps or pain, and weight loss. However, the most common symptom is the severe diarrhea. The cryptosporidiosis does not cause any long-term damage. However, it can be fatal for those who unfortunately have unweakened immune systems. Example, individuals who might have weakened immune systems are those who have Crohn's disease, HIV, AIDS, or receiving cancer or chemotherapy, or kidney dialysis. Transmission of cryptosporidiosis occurs through contaminated public water supplies, accidentally drinking infected water, or maybe even drinking water from the swimming pool or lakes. Another way of transmission is being exposed to human feces or even eating uncooked foods such as salad greens that has been contaminated. So there are very simple steps to prevent yourself from getting this disease, and they are having good hygiene, washing your hands with soap and water for 20 seconds. A tip that I can give you guys, if you can't count for 20 seconds, sing the happy birthday song, and it is equivalent to 20 seconds. And also washing your hands after using the toilet or changing someone's diapers or taking care of someone that has diarrhea. Those are very simple steps that anyone can take to prevent themselves from getting this infection. Advice on how to respond to this infection is that you should always consult your primary doctor, especially if you have a weak immune system. In reality, there is no specific treatment to for cryptosporidiosis. However, in some cases, some antibiotics may be prescribed to the patient. There also may be some antidiarrheal medication that may be prescribed to the individual if, for the severe diarrhea. But however, overall, this infection will, resolve on its own within 2 weeks of the appearance of the symptoms. One tip that is given is that the individual must refrain themselves from any swimming or public area. The diagnosis of this infection is done through examining stool samples. Like I said earlier, there's no treatment specific. However, in some cases, some antibiotics may be prescribed to reduce the overall symptoms of this infection. There might be some antidiarrheal antibiotics that may be prescribed to the patient to reduce the diarrhea. And also that's something that's recommended is fluid replacement therapy for infants or for those individuals who suffer from severe dehydration. Overall, there's really no treatment that is prescribed, and this infection will cure itself approximately in 2 weeks after the appearance of the symptoms. So the prognosis for recovery is that for a healthy person, cryptosporidiosis should clear up with no complications and no treatment because there's really no specific treatment. This infection will not cause any long-term damage, and it can last from 2 weeks up to 1 month, extending it to the most. However, it can be fatal for individuals who have immune-compromised systems, and examples of complications that these patients might face can be malabsorption, pancreatitis, wasting syndrome, and hepatitis. Risk factors and complications are for those who, for example, animal handlers, young children who are obviously, not so careful and are at a very large group setting, and people who work with others who have the disease are at high risk. Most importantly, the individuals who are immune compromised may have serious complications, which can unfortunately sometimes be fatal. For example, individuals who have immune compromised systems are those receiving kidney dialysis and cancer chemotherapy. Well, as you can see here, I have the statistics chart, and something that did get my attention was that in 2019 there was an outbreak in week 30 of cryptosporidiosis. Currently, there hasn't been an outbreak known of this infection. However, in 1993, there were over 400,000 people who were infected by this infection in Milwaukee. And then in 2008, there were over 200,000 people who were infected by this outbreak in Northampton area of England. So here I have my reference page where I got all of my information. I would say that all of these articles were very interesting. I did learn a lot. I did not know this infection existed. However, I am very grateful that I came across these articles and they did really teach me a lot. Well, this is the end, and thank you so much for watching my PowerPoint presentation, and I hope you guys enjoyed it.